Thank you, sir. Thank you, Sahani, sir. Thank you, Hindi team. Now we are moving to our English session. Today is our 1731st day of continuous webinar. Let's start our webinar with a silent prayer. Okay. Good evening, all the participants. Welcome for today's session. Today's our guest is Dr. Namra Anjum. She's a rank holder. She's working with Basel's Homeopathic, and she had done research in the scope of homeopathy in treatment of lifestyle disorders and prognostic factors, research on scope of homeopathy in hypertension, and she had done certification in primary trauma care, health camp organizing in underprivileged areas, working, now she's working in Basel's Homeopathy. And I'm welcoming Dr. Namra Anjum for IFPH webinar. You're welcome. You can start now, please.
Thank you so much, Doctor. Please make me the co-host so that I can share my screen.
You are the co-host now. You can share the screen.
Thank you so much. Ma'am, you're mute. I cannot hear what you're saying.
Yeah, visible and audible. You can.
Thank you so much. So, good evening to everyone present. I am Dr. Namra Anjum. I did my BHMS from Nehru Homeopathic Medical College, Delhi. And today I would like to talk about scope of minimum dose in classical prescription in obtaining fast and permanent cure through homeopathy. So, as the times are progressing and as I am a very junior doctor as compared to rest of you, so what I have noticed is that we try to give as many medicines as possible, as many doses as possible, in this thinking that we will obtain really quick cures. But I would like to share my views in the fact that minimum dose is still the best. That's what Dr. Hahnemann said, and that is what holds true even today. So I would like to start by quoting some aphorisms by our Master Hahnemann. So in Organon of Medicine, Master Hahnemann has given certain cues from which we can understand that minimum dose is the best. In aphorism 2, which we all know by heart, he has said that the whole homeopathic cure, whole homeopathic treatment actually lies on gentleness and least dose, and it should be on easily comprehensible principle. So it should be something that a common man can understand. It should not be something in which there are big words and big fundamentals that nobody really understands other than doctors. Then in aphorism 26, it implies that only the mildest, the smallest possible stimulus is what is needed to trigger our body, our vital force into helping us overcome that disease. In aphorism 246 in 6th edition of Organon of Medicine, it's the most direct reference in which Dr. Hahnemann says that there is no dose that can be so small that it will not act on the body. Every dose, homeopathic dose, has the power to actually act, and it prevents aggravation, and the sensitivity of the vital force is maintained, which is also the infinitesimal amount that our higher potencies have. That is what we say, that the higher the potency, the lesser the aggravation. So in conclusion, we can say that least possible dose, it helps in preventing aggravation. It respects the sensitivity of patient's vital force, and it avoids suppression and promotes a very gentle and natural cure. So there was a French mathematician, Maupertuis, which actually said that the quantity that is required for the least possible quantity that you can use to bring any change, and that is always minimum and infinitesimal, which is what also homeopathy relies on. So the theory and the theoretical part aside, let's move on to a more fun part. Is I would like to share certain of my personal success results from giving minimum single dose, and they've been wonderful results, and I would like to share it with everybody here. So this first is a 24-year-old girl that came to me in OPD, and she was, we get patients who think that, okay, I will get every possible treatment done, and when nothing is happening, then I will go to homeopathy. And then I will see that maybe homeopathy might work, maybe then it won't work. So this girl was one such case. For the past 2 years, she had been suffering from these lesions, which would ooze watery, bloody discharge, and she had nocturnal enuresis. During sleep, she will pass urine. And it has been happening since childhood. And she was 24 to 25 years old when she came to me. And she had this problem that it would itch so much that even during dreams, she would feel like she's itching herself. And she would wake up and she'll see that, okay, I've wet the bed. And she had a lot of self confidence, self esteem issues. She would be very shy to go to anybody's house because of this problem. So, and she had this big, thick folder of all the reports and AIMS treatment and whatnot, every possible private and government doctor she could show to, she had shown. She had taken allopathic medicine, she had taken naturopathy, everything. So, first of all, I felt that this is not something that I can treat by giving ointments or something. The cause lies within. So I took her case, and it took me almost 1.5 hours, and I took a proper case with all the mentals possible. And I found that she is a clear-cut picture of sepia. How we've read in Kent and Emil Tyler what sepia person is, how she was initially, and then how that person develops into the current sepia that we know through Allen's keynotes. She was exactly that. And I repertorized everything, and sepia came on top. And I started with sepia 30. So I gave sepia 30 one dose, and then SL for 15 days. Then again, next time she came, it was much better. The itching had considerably stopped, and usually it would happen that in 1 week she will wet the bed 2 or 3 times. After 2 weeks, she came and she said it happened once, but I am very relieved because I woke up in the middle of wetting the bed and I could see that, okay, I am doing something. Earlier, she would wake up in the morning and realize that, okay, my clothes are wet, my bed is soiled. Then again, I gave sepia 31 dose, one single in sugar of milk. They would put 2-3 drops of sepia 30 and SL for 15 days. Then this way, after 1 month, she came and this was the result. It was like magic. Everything, every single lesion on her whole body, it had disappeared. Only this hyperpigmentation was left, which also disappeared after 4 months. She took treatment from me for 4 months. So this itching and everything she had for the past 2 years, and the nocturnal enuresis was from childhood. So this did not come back. Even after 1 year, I met her. She had brought in some other person to the hospital, and she said, "No, it's a fine. Even those dark spots, they all have considerably reduced." So after that, she continued taking treatment for nocturnal enuresis for 4 months. And I went as high as sepia 10M. And what I did, I used to do the same thing, that sepia 200 one dose. I will repeat a potency twice, 30, 30 for 15 days, 15 days SL, and then sepia 200, 15 days SL. And like that, I went to sepia 10M. When I came to sepia 1M, I gave 1M one dose and 1.5 month SL. Like that, the last medicine I gave was sepia 10M, and after that, she did not come. So I would think often in OPD that why isn't this patient coming? Then I met her when she was showing some other relative in the hospital. And she said, "Doctor, I haven't wet my bed in so long." And then I thought, okay, now I don't need medicine. And she was very happy. So this was actually one of the cases in the very beginning when I had just started sitting in OPDs and started seeing patients. And this was the case that actually made me think that maybe everything that we've been mugging up in Organon and and everything, it actually works, and it works so well. It's not just, usually as students we think, okay, this was written long ago and it doesn't work anymore, but it works, and it works wonderfully. A problem that so many people face, and just single doses, if you count, there were around 8 to 10 doses that that girl had, and it all got cured. So this was one of those cases that gave me a lot of confidence as a doctor. So next case is this man. He came in dispensary. So this is 15 days apart. He had this wart since a very long time here, but it was growing. The problem was since the past 6 months, he said it has started growing, and it's becoming like a stem, like a tree stem. And he was worried because he thought it might go into my eye or something. And the thing was that I just went with the first medicine that we all think, Thuja. I gave Thuja 201 dose and Thuja ointment to put, and I advised him that you need to do it very carefully because it's near your eye. So he said, "No, I'm scared. I don't want to put ointment." So I said, "Okay, you don't put ointment. You just take Thuja 200." So Thuja 200 one dose, and then SL 15 days. After 15 days, that what has considerably reduced that thorniness and that stem-like feature character, the cauliflower growth that all had actually fallen off. And then 1 month later, it was completely clean. And if you see, although these two pictures are taken from a different angle, so it's not very appreciable, he had small warts on his whole face. They had also considerably reduced. His face was speckled with a lot of freckles and small outgrowths, we can call them. And after 1.5 months, it was not completely clean, but it had considerably reduced. And this wart was completely gone. It was plain. The skin was as good as new. So the third case is, I don't have picture. So this man is a 56-year-old man that came to me in dispensary, and he had this. His mother passed away 5 to 6 months ago, and it was not something that it was a sudden death. It was his mother was sick from a very long time, and she passed away. And what happened was that after the funeral was over, all the guests left the house, he started noticing that he cannot do the normal daily day-to-day things that he could do. He was having problem, and eventually within 1 week he was not even able to pick up a cup of tea, because his hands were trembling so much, especially his hands and feet, but also his head, and it was constant nodding. And when I saw him enter the room, I thought that, okay, maybe this person has aortic regurgitation, because we have a sign in that there's nodding of head because of aortic regurgitation. But when I took the history, I found out it's all related to his mother's death. But the surprising thing here was that he was not somebody who was extremely attached to his mother. So when I took his case, I found out that his mother was very loving. But when they started growing up, his mother started differentiating between him and his siblings, and he had a lot of anger and a lot of complaints from his mother. And she passed away before he could actually voice all those complaints. And that stopped up feelings and emotions are what were causing these symptoms. And it was so bad that he said, I cannot even sign on my checkbooks anymore because my handwriting is so illegible, my checks keep bouncing. I can't have tea because I just spill it all over myself. So the whole, and we had referred him to Safdarjung Neurology OPD. Safdarjung Hospital is a government hospital in Delhi. And we did everything by the book. I did everything by the book, that I referred him to neurology also. I told him to get certain tests, nerve conduction test and everything. And so on taking his proper case, and constitutionally his medicine was coming as Natmure. I was quite confused between Natmure and Ignitia, but after repertorizing, Natmure was considerably higher up than Ignitia. So I gave Natmure, as you can see in this prescription slip here, I gave Natmure 31 powder and then Saclac BD for 1 week. 1 week later, that person came, and he came in with such a big smile, and he said that I drank chai today. I was able to drink tea today, and I drank it, and I'm so happy. I don't know what I should. Uh, can we take a 2 minute break? There's azan happening.
I think you can proceed, doctor.
So after 1 week, the trembling of his hands has reduced considerably. The nodding of head was very imperceptible. So you could not really see him nodding his head unless and until you really concentrated. So 1 week single dose, it worked so miraculously. And a medicine like Natmue, that we just see it as a very normal day-to-day medicine that you can give. And it worked in a neurology case, and it worked so well. So again, I repeated Natmue 31 dose and SL30. So after 1 month, after 2 weeks, he was completely fine. 2 weeks later, he again came to me and he said, no, I don't want any more medicines. I just wanted to tell you I'm fine. So this was also a very good case that I saw. The next case I'd like to discuss is, okay, so this was one of the cases that made me feel maybe I am doing something wrong. So this girl comes to me, and she's a 28-year-old female, and she comes in the OPD. And at that time, I was doing research on lifestyle disorders and scope of homeopathy on lifestyle disorder, mainly hypertension, diabetes mellitus, and thyroid disorders, hyperthyroidism and hypothyroidism both. So she came to me and she said, I've heard that you people treat thyroid disorders. Will you be able to cure me? And she was 28 years old, and I thought that, I mean, how big of a thyroid disease can she have? So I said, yeah, you show me your reports. And she showed me these consecutive reports of 5-6 blood tests done every 2 to 3 months, and in all the reports TSH was more than 100. And I was a little skeptical, but I thought, okay, let's try. So the same procedure that I have, I took a proper constitutional case. I gave a single dose and SL. And in thyroid disorders, I don't give any mother tincture. So I gave that and I said that, okay, you come next time. And then I kept repeating it. I started increasing the potency. After 2 to 3 months, I asked her to get a blood test done again. And I was pretty confident that maybe slight change I'll be able to see, because the repertorization was, I had done a good case taking. I knew that I have not cut corners. So the next time, I also got anti-TPO done because I was worried maybe it's autoimmune if she's had TSH so high for so long. But anti-TPO was also normal, so there was no chance that it's autoimmune. Next time she comes on April 14th. Earlier, when she had the fresh blood test she had done was December 17, 2023, and this is April 14, 2024. So almost 4 months later, and the blood test is same. TSH again more than 100. So I was a little worried. Then I did the case taking again, and again the same medicine came. So I thought, okay, let me try once more. So again, 2-3 months I gave her medicine. I did my whole protocol. Then finally, from April, then till August 9. On August 9, she got her blood test done, and then we had TSH 22.5. So this was actually one of the cases where I was really doubtful that am I doing something wrong? Why is there no effort, nothing, no result coming? So quarter of a year it took for the TSH to come from more than 100 to 22.5. And I don't have further reports, but it actually came down to normal and she stopped taking allopathic also. She had actually gone into a phase where she said that I don't want to take medicines my whole life and it's better if I just don't take it. So when she came to me, she had stopped taking the thyroxine allopathic tablets since almost 2 to 3 months back. She said I've stopped buying them. They're very expensive, and I don't want to take medicines anymore. So now I would like to talk about when we take a case. We all of us can sort of make an idea while talking to a patient that okay, this could be pulsatilla or natmute, but there are certain really good mind rubrics in synthesis repertory that probably people don't know about, and they really fit very well in current scenario and the kind of people we see around us, the Gen Z situation, Gen Z generation that we say, and our older generation. There are some really good rubrics that I use, and if you are interested you can take a screenshot, and I hope it will help you. So the first one is, it's called inui. So it's that feeling that you're just bored, you don't feel happy, you're very dissatisfied and listless, and it's because there is no occupation or excitement. So this what I mostly see this condition is in people who have just graduated and they don't have any job yet. So they're sitting at home and almost everybody is asking them that, okay, what are you doing now? Are you earning money? Are you going to do any more courses? And they feel very useless and they feel very restless that what am I doing with my life? And am I mean, they, what we say as existential crisis, and people of my generation, they go through this a lot because we don't know that we have to do MD or we have to do job. Also people who have retired, who have just retired, 60, 62 year old, and suddenly their whole routine has changed. Earlier they had a sense of purposefulness and they had a purpose. They would get ready, they would go to their work in the morning. Now they're just at home and they don't know what to do with themselves and they're very dissatisfied. They feel like I can do something really better. This rubric really helped me during COVID time because I think almost all of us were feeling that way. We were all fine, thankfully, but we had this feeling that it's been so long. What are we doing? We're just sitting at homes. So this rubric, and it has a lot of remedies. Calc as you can see, is third grade, first grade. It's a very good rubric. The next I have is mind postponing everything to next day. This I think fits for people of my the students and the college going students and everybody who procrastinates. I will do this tomorrow. Usually mothers come and mothers say that I keep telling him to make his bed, I keep telling him to clean his room and he doesn't clean his room. So two rubrics you can use and you will have to differentiate between them. One is, if the child says that no, I'll do it, I'll just do it later, my mother doesn't understand, I say I will do it. I'll just do it in the evening. So that is mind postponing everything to the next day, that he's plain lazy. He said, okay, I'll do it. I just don't want to do it right now. But there are certain people who will tell you on further probing that, ma'am, I don't know what it is. It's not that I like living in a dirty room. I just, sometimes when I'm lying in bed, I don't want to get up. If I'm sitting, I just want to keep sitting. If I'm using my phone, I just want to keep using it. I don't want to change. And that is something that we call as, it's forced inertia in our brain, and it's also a milder symptom of depression and anxiety, in which the person is so scared, so anxious to change even the littlest thing, because he's scared it will trigger his anxiety. And this is really found in preteens these days. I don't know why this shift is happening, that it's found in preteens, but I have read certain researches in which they say that symptoms of depression and anxiety, ages of 11 to 15, it's really high in that age group. So I think this is a very good rubric, and these are very similar rubrics, but certain points that helps us in differentiating between them. Okay, next we have temerity. So temerity means excessive boldness or confidence, audacity. So this you will find in uh, the just young adults, and sometimes even 40 to 45 age group people who are really successful in their lives and who are at good positions, good occupations, and they're sort of used to having PAs and people catering to them. They will come in your clinic and they'll say that, your clinic, it's not very beautiful, and you should have you should have good chairs, and you should have this. Excessive boldness and confidence, even if there is no cause for it. So temerity, even though there are really less medicines, all the medicines are the medicines that people you will find in the real world. Midorinum, opium, platina, these are the kind of people you find in day-to-day time. Next is temper tantrums, which I'm sure I don't have to explain. Also, it sometimes happens that if you're working in a hospital where there's a lot of rush, so somebody who's standing in line since past 5 minutes, he will start getting angry and saying, I've been waiting for 1 month, well, I've been waiting for 1 hour, and you're so slow, start seeing patients faster. We can use this then. Then mind affectation. So affectation is this pretentious act that you do to impress others. So sometimes you would feel that there are certain patients who will say whatever you want them to say, or they will say it in a way that they want you, okay, the doctor should be impressed that, doctor, I'm a very good student and I do all my work properly. And no, I was a high scorer. Or you'll ask that, do you take medicines on time? And he said, yes, yes, I take everything on time. So affectation, it's basically the rubric that you will use when you feel that the patient is not very truthful, and not just that he's lying, he's also saying it in a way to impress this person. Not impress in that sense, but also he wants the other person to think highly of him. He's putting on a show. So that's when affectation we use. Next we have one second, yeah. Once, yes. So this mind ailments from quarreling is basically, I would like to share a story about this. So a mother came to OPD, and she had her daughter. That daughter was in class 10th, so she'll be around 15 years old, and she was in a school dress. The mother had directly brought the daughter after picking her up from school, and they sat down, and the mother said that my daughter has asthma. Do you have anything for that? So I said, okay, yeah, we have. And I asked her that, since when does she have asthma? Do you have any reports? Have you done a PFT or any kind of any investigation? So they said, no, no. But since 1.5 years, she's had asthma. So that was a little confusing for me, that somebody who has asthma is not taking any medication, doesn't have a pump, has no history, no investigation. So I started asking questions. I asked the girl, the 15-year-old girl, that what happens when, how do you know, why do you think that you have asthma? So she said that, ma'am, sometimes I feel like I can't breathe, and I feel very suffocated, and then I can't breathe. And that only happens in asthma. That's what the child said. So I sent the mother outside, and I said, you tell me, what is the situation when you feel that, you can't breathe? So she said nothing. I would just be sitting in class and suddenly I feel like I can't take a breath and my heart is really racing and I will really have to gasp. And then everybody looks at me weirdly and that makes it even worse. So eventually I came to the conclusion that what she has is not asthma. What she's experiencing is a milder form of anxiety attack. So she's having anxiety and she's not able to understand that this is what I'm feeling is anxiety, and her parents also don't understand that. Everybody thinks that it's a respiratory issue and she has asthma because she can't breathe. So I took a proper case. I asked her that, okay, how was your childhood? Where were you brought up? Was it a joint family or a nuclear family? So she said that no, it was a nuclear family. And then how were your parents? Were you brought up with love? So she said, no, I was brought up with love. I was the second child and she was the first daughter. Earlier, her elder was a brother and she was the first daughter and she was brought up with a lot of love. Her mother loves her, her father loves her. And then I asked her, how are your parents' relationship? And she said, no, they fight a lot. Ma'am, I can't even tell you. Sometimes I feel like running from my house. They fight so much. So I asked her, okay, and how do you feel? And she says, sometimes I would just cry at in my bed when my parents would fight. And when I was growing up, she said this really sad thing that, when I was growing up, I was really young. My earliest memories are that my father would come home from work and my mother will tell us that go sleep, and then she will shut the door of our bedroom and I will hear them screaming. I will hear the screaming and shouting and fighting. So all that thing, all those quarreling and those fights of our parents has actually put in a trigger for shouts and loud noises in her. So that now in school, if school is a very noisy place, if a teacher shouts, she starts getting this anxiety. So I said, how are things at home now? Are your parents still fighting? Is the situation any better? And she said, no, now they don't talk at all. They don't talk. And it's been since years that my father comes home very late at night and they don't talk, and my house is pretty much silent. But that childhood problem, when she would hear her parents fight, even though both her parents were very loving towards the kids, they were not abusive towards their children. But that is the root cause of her anxiety. Even now, if she even hears a group of boys or group of girls coming in, they're very boisterous, very loud, she gets this feeling that, oh, I'm having asthma. So this this rubric was actually which helped me individualize her remedy, and she was very much better after that. So mind ailments from quarreling. It could be quarreling of parents and it could also be quarreling between like interpersonal one-on-one. Second is mind grief silent. So this we will find in a lot of people in men. I have seen that this rubric you really find it in men because in our society we sort of see that the men, some people, they have to take responsibility very very early. Maybe their parents don't earn enough and they have all this grief that they have their brother's responsibility, their parents responsibility, somebody's parents pass away and then they had to take care of the whole house, and they have this silent grief and they don't have anybody to express it to. And sometimes it has happened that I would be asking a 45, 55-year-old man that, okay, tell me about your childhood. How was it? How were your relationship with your parents? And while talking about them, they would start crying. And then they will say, ki, man, this is the first time in the past 20 years I've cried like this in front of somebody. So this rubric, it has a lot of good remedies, but also this rubric, it's so common. And if you actually prod deeper, you will find it in so many men, and it's a very sad thing. Also in widows from a conservative sort of background, where sometimes it's encouraged that, okay, if somebody's husband has died, you can get married to his other brother or somebody else, so that she isn't left without any support. And then she had this grief, husband of 20 years and then he died and then now she's married to somebody else. In these cases this rubric is really helpful. And miscarriages also. Then next, we have mind forsaken feeling. This rubric, most of the time, I forsaken. First of all, forsaken is that feeling where you think everybody has left me, everybody has abandoned me, and nobody cares about me anymore. And this I find in old mothers, mothers who have married off their daughters and their sons, and they're living with their sons. and probably their husbands have passed away, and then they say that my daughter-in-law doesn't really love me like my daughters used to, and my daughter-in-law doesn't even ask me for a cup of tea, and my husband doesn't and sorry, my son doesn't talk to me, my son talks to his wife, and they say all these things, which I think is very common, and all of us must have heard those things from older ladies in our family, in our neighborhood. And they say that nobody even wants to have a cup of tea with me, nobody asks me, they don't care, I'm an old lady now, I did everything for them and now nobody cares. This forsaken feeling, also this forsaken feeling comes when there's a history of some sort of property dispute. So that one brother or one sibling who didn't get property, he will have this really strong forsaken feeling that my parents betrayed me, my siblings betrayed me. Okay, so the last rubric is, it's kind of a funny rubric, and it's open to interpretation to every doctor. So mind, coquettish too much. So coquettish, for those of you who don't know, coquettish is, those certain girls or boys, a person who dresses to impress, and he will walk in that impressing manner, and he will talk in an impressing manner, and you will see, even if they're wearing plain white clothes, those plain white clothes will be different from everybody else's clothes. Even if they're wearing the same thing as everybody else, there would be something that is very impressive. And it's not the X factor that we say that, okay, they have a good personality. They put in a lot of effort for it, so that you will stop and you will look at them, okay, okay, wow, this girl or this boy. So that is coquettish. So when it is too much, that you can see from a mile away, okay, okay, this person, probably they put on a lot of deo, or when they will walk in, the tuck 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 of their heels, and they sit down and you think, okay, nice, she's like really impressive. But you can also see that she's put in a lot of effort. Same with men or teenagers, Gen Z children. So mind, coquettish too much, and children, in the same thing you can apply to children. So that is it. That is the end of my presentation. Thank you. And I hope I was able to share some of my experience and some of my knowledge with all of you. And I hope you could understand what I was trying to say. And I am very honored that I actually got this chance. And thank you so much to Abdul Salam sir, to Dr. Abida Salam, who wished me before the meeting. Ma'am, your wish really, it gave me a boost of confidence. Dr. Basil, who had supported me since day one. Dr. Basil, I really want to take this minute to say that thank you for seeing me as your young assistant. Thank you for giving me so many opportunities. And ma'am, who was the host, Ajini Maili Yakal ma'am. I'm so sorry if I mispronounce your name. And everybody who sat through my presentation without getting bored. Thank you so much. It meant a lot. It means a lot to me.
Thank you so much. It is a really wonderful presentation, and I think you stopped earlier because we have half an hour more than 25 minutes. It's okay. If anyone have question, means please raise your hands and you can ask questions.
I think I speak a little too fast also when I get excited. So it's
Yeah. Many of us are like that. For me also it happens.
Dr. Namra, very nice presentation.
Thank you so much, sir.
It's enough. It's enough. Now we can start our discussion.
Yeah.
Okay, thank you.
Dr. Hariharan has raised hand.
Good evening.
Dr. Hariharan, you can ask.
Okay, Dr. Namra, see.
Hello, sir.
Very good. Congratulations.
Thank you.
See, now everybody, now a trend is prevailing in homeopathy is that, see, everybody want the protocol method. See, but homeopathy really want, see, scientific method. That is what you said is very correct. And such a way we must practice. If we practice in such a way, we can achieve a lot of cases which is supposed to be not curable. We can cure such cases through this classical method.
Exactly, sir.
So I really congratulate you. see in this for this class, but I like to ask one question. While you are treating a thyroid case, will you stop the allopathic medicine, then you continue, or taper the medicine and continue the homeopathic medicine?
So
How is your?
yes, sir. The protocol that I follow is that for the first 1.5 months, I tell them to take the allopathic medicine the same way they were taken. If they're taking 75 mg, 125 mg, I tell them to take it normally. So 1.5 months, I think, is enough for a homeopathic medicine to act the way it's supposed to act. After 1.5 months, I tell them that if, for example, they were taking 75 mg, I'll say come down to 50 mg. No, sorry. From 75 mg daily, I make them take it every alternate day. So that way, for 1.5 months, they'll take 75 mg day, every alternate day. Then when we get after, so it'll be 3 months, 1.5 months, 1.5 months. So after 3 months, there is 99% of the cases the TSH comes down. So then I shift them to 50. Then I ask them to take 50 every day, because earlier the body was used to 75 mg and then now 50, it might actually cause a reaction. So 50 every day for 15 days, then 50 mg every alternate day. That way I taper it down and I try to reduce the potency every 1.5 months. Because what happens is, if it's somebody who's younger than 35 years old, you can actually change potency or skip potencies also, because the vital force can handle. But most of the time, apart from this case, most of the time we get 50-year-old, 45-year-old ladies who are sick, who are anemic, who have had so many children that they don't even have time to take proper medication. So we cannot actually mess up the potencies there. Also, I think that once you come down to 12.5 mg, then you don't need to ask them to take allopathic medicine anymore. You continue your thyroid, and thyroidinum 30 works best. I have tried seeing thyroidinum 200 also, 1m also, 10m also, thyroidinum 30. Even if you give it for 6 months continuously, it will continue working. In thyroid, I think, is the only disease in which I have seen that without even raising the potency, it keeps working, and it works wonderfully. It works like magic. So thyroidinum 30, all the while tapering down the allopathic medicine dose and then stopping the allopathic medicine. After you stop the allopathic medicine, and if the TSH was within like 16, 20, it was not more than 20, you can continue giving thyroidinum 30 for next 3 months. After that, you ask them if earlier you were giving thyroidinum 30 TDS for 3 months after stopping allopathic medicine, then you switch it to 2 VD twice a day for 1 month. Then you switch it to OD for next 3 months. And then you actually give them a thyroidinum 200 packet and you say just take it once a week. And it becomes so much easier for the patient also. They just take it once a week, and then it's easier for them to remember also that, okay, every Friday or every Sunday I have to take it. My mother, the reason why I was so interested in seeing homeopathic cure for thyroid is my mother is a hypothyroidism patient, and she's been a hypothyroidism patient since as long as I can remember. And she doesn't exercise, she doesn't do any dietary restriction. She doesn't want to do anything. So since first year onwards, I would go to OPDs and I would ask all these senior doctors that, sir, can we cure thyroid? My mother is a thyroid patient. So the problem with my mother, and I think with a lot of mothers, is that they just want us to eat everything and to be fine and healthy, and they don't take care of themselves. So during my internship, I would literally just give her medicine before going to college, and then when I would come back home, I will give her medicine. So within, it was 3.5 months, her thyroid was around 28, TSH was around 28. Within 3.5 months, it came to 3.46. And then after that, I have maintained it. The problem is that I have to give her medicine. She doesn't want to eat it. So, but right now I give her every 15 days thyroidinum 200 one dose. The liquid, I give 3 drops in this much water. And every 15 days I give, and it's stable. It's been almost 1.5 years and it's completely stable. Her thyroid, the levels have not changed.
Okay, very good, very good. 1 minute, okay, 1 minute. Doctor, what is your experience regarding TPO?
Anti-TPO test.
Okay, when the TPO is high, what is your approach towards that case? Any intercurrent remedy you will use or not?
Sir, to be honest, I've had only 5 or 6 patients with raised anti-TPO. But what I try is that once you see that, okay, this is going towards autoimmunity, it's on the border, it's 8.9 or 9.1, or it is really high, it's 12, 15, or even higher. So if it's on the border, you can actually give a higher dose of that constitutional remedy. Just take the fresh case, put in as many mentals, as many specifics as you can, and just give a really high dose of that constitutional remedy. So if the person is Mido and you're right now on Mido 30, you just give Mido 10 ml and you wait for 1.5 months. It works. It was, I am not sure if it's written in any theoretical book, but it really works. So my
Correct.
patient was
Correct.
anti-TB.
Good. Your way of approach is very correct.
Thank you.
Your way of approach is very correct. See, another question. Suppose you took the case and gave the medicine, and then you find out that the medicine is not working, and the TSH is not coming down. Then any other approach you have? See, where this it may be due to the disorder of hypothalamus or anterior pituitary or such cases. What will be your approach?
Okay, so one I have a good girl approach, as I like it and like to call it, and one I have a life hack. So I'll tell you both. So one is that what I do is I basically just ask for the thyroid profile and anti-TPO. But if nothing is working, then I ask them to get, we need to see if there's empty cella turcica syndrome or any other hypothalamus axis is not working properly. So I get all those investigations done. If all of them are also coming right, then that means there's something wrong in my prescription. So the first thing I do is that the repertorization that I have done, as long as I have a patient, I keep it with me. I write it down on their OPD slips. So I re-ask them, but I ask them in sort of a communication way. So for example, if that patient has told me that, I don't have good relation with my family. So I will ask them that, how's your brother now? How's your sister-in-law? So that way I cross-check my answers, my repertorization. If my repertorization and my remedy, everything is correct, still it's not working, then I give an intercurrent remedy.
Correct.
Also,
Correct.
one
Good.
thing that I do is that if I want a little quicker action, and sometimes what happens is the patient gets very agitated and they're saying that so many months it's happened and I am not getting any result. Are you just giving me blank pills? I give mother tincture, and mother tincture always works. Although I try that I should always give constitutional and you should go to the root cause, but mother tincture it satisfies the patient. You can give iodine, you can give any mother tincture that looks very similar to that person's characteristic, or it looks very similar to the pathological picture. Even if it doesn't match the person, you just give it for one week and you give like 15 drops TDS. It works and the patient is satisfied. And if you have more time with the patient and the patient is staying with you, then you can actually cure him. But with this stubbornness that no, I will only give single dose and the patient will not stick, so I will not get the chance to cure him. So that is my life hack. I give mother tincture sometimes.
Okay. See, you are not tried this anterior pituitarium or hypothalamus in potencies. That 1 or 10 you have not tried it.
No, I've tried every medicine. Not every medicine. I mean, I've tried almost all the therapeutics that we study, but I try to give constitutional mainly. I feel like
Very good.
it works
Very good. Very good. That is the correct way. Constitutional approach is the correct way. Exact constitutional approach is the actual miasmatic way. So that we will get the result 100%. We can assure that if the constitution is correct, we will get the correct result. So
Exactly.
your approach is very correct. Go ahead. See, you have a very fine future. So thank you very much your class, doctor. Okay, see you again.
Thank you so much, sir. Thank you, sir. One thing, if I can say, if there's time, ma'am.
Yes.
So this one thing point I had wanted to discuss and I then forgot while I was giving the presentation was mother tinctures, right? So mother tinctures, all of us have tried, and we know that they work wonderfully, especially in hypertension and diabetes, right? They bring down sugar and BP like magic. But one issue I would like to say with them is that there is not enough research done on them, especially our Indian mother tinctures. They work very well. There's not enough research done on it, and so we don't know the kind of effect they're having on our kidneys, on our body organs. I know that we say that homeopathic medicine is 100% safe. It is safe. It doesn't have side effects. But in reality, realistically, we cannot say that anything doesn't have side effect. Even water, right? That is the soul, that is the main important thing for us to survive. Even water, if you take too much water, your body goes into water toxicity. If you take water more than 6 liters per day, your body gets water toxicity. So if water can be a poison to you, then medicines that are prepared by humans, they can harm you. So I did this sort of experiment that whenever because with diabetes you need to give mother tinctures, right? Because somebody who doesn't want to take metformin tablet, then you need to give mother tincture so that you can replace it. So what I did was that the first time they would come to me, I will fill the biochemistry lab report with KFT, LFT, all of those, and I would get them. I will tell them that get these blood tests. So that is day zero. That day I prescribed them 1 month mother tincture, and I have the blood report. I know that okay, creatinine was this much, KFT, all reports, everything was this much. Then after 3 months, I again asked them to get KFT and everything done. And in every single case, I have seen that when you continuously give mother tincture for 3 months, the KFT, the values change, and they actually decrease. Even if they don't go into this really, they don't become abnormal. That's not what I'm saying, but there is a slight change, and you will be able to see it. Because obviously mother tinctures have a much higher quantity of alcohol in it, and it's much more less potentized than our 1 m and 230. So we should be really careful, I would say. And this habit that some people have, that they will tell their relatives that, oh, you have this, just take this medicine, and that person will keep taking that medicine for 6 months, 1 year, and they don't understand that you need to stop at some point. It really harms. It might not send your kidney into failure, but we should understand that we have a responsibility to our patients, that if we are giving medicine, and even if it's benefiting them, it is something to keep in the back of your head, that Indian mother tinctures, and even mother tinctures, and we give three mother tinctures together, there is not enough research that is done that can actually see the interaction that all these different medicines are doing in our body and how it's affecting our body. So I think it's something to keep in mind, and that's why I try to give as little medicine as possible. Because my father, he suffers from a lot of disease, and I am always paranoid that something might happen, something might happen. So I always try that, I should just give him the least amount of medicine. So that's the same approach I have towards other patients, that their family members should not be paranoid that even though he's better, why is this deteriorating? His health is deteriorating. So not saying that homeopathic medicines deteriorate health, they are perfectly fine, but we should just be a little more conscientious while prescribing mother tinctures, even though they work really beautifully. That's it.
Thank you, Dr. Namra. And I think Dr. Ram Parvesh Shah. Okay, I'll now you can unmute yourself. Okay.
Thank you, Dr. Nimi, and everyone. Namaskar, Dr. Abdul Salam is the salute and congratulations, Dr. Namra.
Thank you, sir.
Very nice presentation, excellent session. According to homeopathic, classical advice and a scope of minimum dose and classical treatment. So very good describe the session in the classical way. Thyroid endocrine gland deficiency. Yeah. So there are three lifestyle is the important role. Lifestyle, मतलब electrical disbalance after chemical disturb. So chemical disturb is called hormonal disturb. The hormonal disturb other pathological change. So pathological change, the mother tincture is a very good remedy. And angle of treatment, symptomological angle, miasmatical angle, and pathological angle. So symptomological angle and constitutional angle very good describe the medicine. And single dose, single remedy, and minimum dose. So very, very nice, Dr. Namra. Thank you.
Thank you, sir.
Thank you.
Thank you so much, Dr. Basil. You can.
Actually, very thank you to IFPH team for giving an opportunity. While presenting, my doctors are presenting. Actually, my heartbeat is increasing a lot. If myself is presenting, I don't have any tension. If you are telling me to present anything in any subject that I know, I will present it without any tension. But my heart was beating. And even one staff of me, I was in between consultation, and she asked me what happened. I told that doctor is presenting, and it is very highly interesting and informative. Thank you once again for the coordination. I am thanking for giving such a new information to the homeopathic world. Once again, thank you. Congratulations, Dr. Namra and team homeopathy, and especially Ramsha sir and Dr. Salamka, everyone. Thank you once again, and the supporting team, Dr. Abida Salam, our team leader, everyone. Thank you, Dr. Karuna.
Thank you, Dr. Basil. And if anyone have questions, you can ask question. We have 5 more minutes. If you have question, please come forward. Otherwise, we will wind it up. Okay. Dr. Sri Lakshmi. Okay, you can ask now. Please unmute yourself and ask. Okay. Now.
Hello, Dr. Namra. It was a very informative section and so good presentation, and your way of answering was also very nice. Thank you so much.
Thank you so much.
Yeah, that is true. In the beginning of the session, Dr. Namra was telling, I'm so junior to all of you here are so experienced and seniors, but the energy that you are carrying and your confidence level that you are carrying is very higher than all of us. The way you are answering, everything is in your tip of tongue. Very nice it is. You're so confident. I think it will become great.
It's a topic I feel very passionately about. I've really researched on it.
Yeah.
Now, Dr. Namra is a dynamic lecture. According to scientific, minimum dose, single dose, very good. Described.
Thank you so much.
Thank
Yeah.
you.
Dr. Ali, I'm so sorry, the name I get confused.
It's
But
okay. Tell me what do you want to ask?
Dr. Ellie Kairam ma'am is saying in the chat box, Doctor, can you share a few words regarding LM potency? Oh, yes.
Okay.
Okay. So LM potency, I have used it. I have not used it every time, but one very, very successful case I had was usually I use it after I have given till CM potency, right? So even after CM, you have that something still, matlab, that person is not still 100% perfect. Then I switch to 0/1. And what I do is I give alternate. So 0/1, 0/1, 0/3, 0/5, or you go by even 0/2, 0/4. So this couple came to me in OPD, and the first thing that the couple did was the husband and the wife. So the OPD slip, the wife's name was written, and she was just sitting there. And the husband said, and they were around 45, 50-year-old. So the husband said, ma'am, she has OCD. And I was a little taken aback because you know, you look at somebody and then you sort of make an image in your
They
head.
have only 3 minutes. Make it
Okay.
fast. And one more participants. I mean, Dr. Sadat raised hand to ask question.
So very
Can
short
I-
story is that she had OCD. It was diagnosed by Ames, and arsenic I gave 0/1, then 0/3, 0/5 like that. And it in around 3 to 4 months, her OCD, very severe OCD symptoms actually reduced, and it was really successful case. So it helped
Thank
her
you.
on a mental level.
Thank you. Dr. Sadat said, you can
No,
ask.
I don't wanted to ask any question. I just wanted to tell her the confidence and the way she was talking about it. It's not easy for a junior to come and talk to all the seniors.
Yeah.
Thank you so much.
It's the first time. I don't know. Basil is doing a great job in mentoring these people. Because I have had we have been organizing seminars and these people from Basil's homeopathy have come there. The wonderful sessions and the confidence they talk. Amazing work with Basil and team.
You've made my day. You've made my whole
Wow,
week. All
wow.
of you senior doctors saying this. Thank you.
Okay, then now I'm inviting Dr. Abida Salam for giving out of thanks to Dr. Namra. Dr. Abida Salam, you're welcome.
Thank you, Doctor. And Dr. Namra, really, like as everybody has said, you have really put the session to a very interesting level. Keep up the good work from each, and you know, the sincerity in each of your case taking from the beginning throughout the case, including the repetization and how you evaluate the case, like how it is progressing. Mashallah, very good. Keep up the good work. And even the special rubrics which you added in between as an added bonus, everything. And you know, giving the replies to each of the questions which are asked, everything. Keep up the good work. A lot is awaiting ahead of you, and God bless you. And thanks to all the participants who have been with us patiently, hearing throughout the session. And have a good day to everybody. Thank you.
Thank
Thank you
you.
so much.
Thank you. Thank you.
Thank you, Dr. Abida Salam, and thank you, Dr. Namra, once again. And you have many appreciation in the chat box. Please check the chat box also. And thank you. I'm appreciate for the knowledge that you have shared here. Come again and teach us. Now we are winding up the session because it is now time for the Malayalam session. Thank you so much.
All of you, please pray for my AIPGT 2025. This is my first time. I just graduated. Please pray that it goes well.
Sure. Okay, then I am inviting Dr. P. Thank you all the participants for your active participation. Thank you so much. And now I am inviting Dr. P. Shaila for moderating Malayalam session. You can close the, yeah. Thank you.